recorded.
This is the January 19th, 2021 Board of Selectmen agenda for Upton, Massachusetts, and I will call the meeting to order pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the Governor's March 15th order concerning imposition on strict limitations on the number of people that may gather in one place. Meetings in the town of Upton are being conducted via remote participation to the greatest extent possible. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure the public can adequately access the proceedings as provided for in the order. With that, our first item is any public comment that folks have before we jump into the agenda. On the agenda, we have approval of meeting minutes. Representative Moradian is here. The Board of Health is here for a COVID-19 update. And then the board will be discussing the budget presentation for the upcoming town meeting and accepting a donation. So with that, Maureen or Steve, any chance to review the December 15th and January 5th minutes?
I have. Have you, Steve?
No, actually, I was not able to open the email with the minutes. So I don't know if it's okay with you folks. We could delay it till our next meeting.
Yeah, that's fine with me. The only thing we should be mindful of is I don't think that we're posting draft minutes on the website. So, okay, so Derek's nodding his head. So the longer it takes us to approve the minutes, the longer it is before people can see the minutes online. But you know, I don't think that's an issue. Just something to be aware of. That's all.
I'll fire off an email right now to make sure. Sometimes I think there's a format problem with my particular email server. Okay. Most of the time, I don't have a problem opening them. Believe it or not, I think when we changed our server on our web page, I actually had a little bit of trouble logging on to even these go-to meetings. So I think the hiccup is on my end, but hopefully we can get that taken care of before the next meeting.
Yeah, okay, cool. And next up, we have our special guest, Representative Dave Moradian. So Congressman, I will hand it over to you.
Well, I don't know if I'd wish the congressman on anyone right now, but I appreciate it, Mr. Chairman. Thank you all for letting me and inviting me to come and speak to you remotely. Obviously, you know how much I enjoy coming in person, but here we are in the pandemic. You know, I've tried throughout the whole pandemic to maintain constant contact with Derek and then all my other town managers and also many kind of different figureheads throughout the town, whether it's maintaining contact with the chief of fire, chief of police, and others, just to make sure that they knew that I was here for anything that you might all need. I appreciate you reaching out and giving me a little bit of heads up as to some of the things that you're hoping to talk about. Obviously, I'm willing to talk about anything, but in no particular order. If that's okay with you, I'll kind of bounce around and cover a bunch of those topics so we can talk about some other stuff at the end too. I know there was a big push in terms of the downtown revitalization, and in speaking with Derek, it seems like that might be actually something that's coming down the pipeline in a couple of years through DOT and their process. But you guys know full well that I've had individuals from Massworks come out, housing and economic development, transportation, anything to try to invest in that downtown, because I think it's an absolute jewel. And it's going to be a focal point for our community, and we're going to try to drive people there. So that being said, there is a 2021 State Traffic Safety Information System Improvement Grant. It's much more towards the traffic safety aspect, so I'm not too sure if we can sneak out some funding through it to try to go the revitalization. But that was posted on December 29th. And letters of intent are due by February 10th. So I can get all that information over on the side as well, so we don't kind of get bogged down in that. But that's one of kind of the grant potentials that's out there. Obviously, I mentioned Massworks again. I've been very fortunate to be successful in securing Massworks funding in Grafton for Route 30, which is another corridor within my awesome district that I think can expand, and it's exciting. It really is to see what the future could bring. Food and housing security, we've done a lot actually very recently in terms of it. I think it's nice to say that there is a PEBT benefit out there. It's a federal program. It was created in the spring of 2020. It's to provide additional funds for families to buy food while the schools were closed, and obviously now kind of in the hybrid whatnot. So to be eligible, the student must qualify for free reduced lunch price for the reduced price school meals under the National School Lunch Program. So that includes any student in a school that provided free meals to all students under like a community eligibility provision. So I also know the administration, in conjunction with the legislature, passed many pieces of legislation, some very, very timely in the beginning of all this, to make sure that we had funds out there. Most recently, there was $5.5 million, which was back in, I believe, October, to address food security in Massachusetts. There was also grants and funding towards farms, which we don't really think of when we talk about maybe all the small businesses that need the help, but certainly farms to make sure that we're eating the healthy food that they're producing, and we have some great farms locally. In terms of, housing assistance, there was a huge economic development bill, which I'll talk about in a little bit, that included basically Governor Baker's housing choice proposal inside of it. There were a couple of spots that he did veto sections, as he didn't think that they matched up quite in line with what they were looking for. But, there's certainly programs that are tiered towards the low-income households. There's RAFT, which is the Residential Assistance for Families in Transition. And there's the Emergency Rental and Mortgage Assistance, it's called IRMA programs, which provide income-eligible households with up to $10,000 to pay overdue or future rent or mortgage costs. And they can be applied to both programs at one of 11 regional agencies. Obviously, we paused the moratorium on evictions and everything associated with that, because with many people out of work, no fault of their own, obviously, making sure that they're able to pay their rent, you want to try to help them out. We certainly need to try to help the landlords out too. So RAFT and Upton's regional agency is RCAP, and we've worked extensively with them. They're a great resource. Landlords who own less than 20 units of housing may apply directly for RAFT or IRMA on behalf of their tenants. It's important, obviously, that the landlords and the tenants work together and have a good, harmonious relationship, because you don't want to have both applying at once. Then it could kind of bog down the whole process there. Moving to, I see Trish here, moving forward to the vaccine. And I was fortunate enough to tour the NIPMOC site this weekend with Derek and with you, Brett, and it was outstanding. I tip my hat off to you all in Upton. I mean, it was so cool to see that light at the end of this really dark tunnel, and you could actually see it tangibly there when you're holding, the vials, and you did an excellent job. Everything that I've heard has been just kudos and kudos and kudos for a job well done. All the first responders, especially from Northbridge who were there, really enjoyed their time. I talked to people from Salmon and from Beaumont who actually had the nurses there administering the shots, and they just said it ran so well. So anything I can do to continue to promote that and make sure that we can get those first responders ready to go so they can keep protecting our communities, I'm absolutely happy to support. Talking about the vaccine, the rollout's still in phase 1. We're now kind of starting to get to the next segment of the population. We're in the process of finishing the nurses, first responders. Now within the next segment of that tier, it's congregate care settings, so shelters, group homes, correction facilities, things of that nature. So that's the next rollout. And so obviously, it takes time because, you have to have the 3, sometimes 4 week window in between with the first shot and the second shot. And then there are many conflicting stories, none from the local affiliates in Upton, because they're always spot on with their reporting, but there are conflicting reports as to if Massachusetts got a whole heck of a lot of the allocation and didn't do it, or if they got none of it and are saying that they are. And In talking with Health and Human Services, it seems that pretty much everything that we have has been distributed. Now, some of the hospitals are taking their time and slow playing some of the administering because they didn't want to run afoul of the law and potentially get fined or anything like that. But you also hear many stories of locations that they might have a couple of doses left over and they're trying to get those out because obviously you want to use them if you can. So also the question was raised of how do we pay? What's going on with that? And the good news is it's all on the feds. So I guess the cynic in me can say that your taxes pay for it. But basically the Commonwealth hasn't had to pay for any of the doses of the Pfizer or Moderna vaccine. It's all being distributed from the feds. That also being said, that's some of the reason why it's taking a little bit longer is you can imagine the red tape of government in terms of getting that rolled out. Now, we did pass a budget, which was many, many months after we typically do. And in the process, we had to reevaluate all of the numbers, the consensus revenue and projections and things of that nature. The good news is I was still able, with the help and support of Senator Moore, to secure an earmark for Upton, which was $15,000 for public health and safety improvements. It's not, it's a little bit lower than what we typically get, but trust me, not every community was able to secure funding in this budget. So I'm really thankful and proud that we were able to get that in there. The end of session highlights, and I touched on some of them earlier, especially the economic development bill. That was a $620 million bond bill. In it included a lot of the governor's housing choice proposal, geared especially towards affordable housing and multifamily zoning, which especially is true by MBTA stations and the communities surrounding them. In there was included, and this is also from your team of Rep. Moradian and Senator Moore, in there it says that not less than $500,000 shall be expended equally between Worcester, Auburn, Grafton, Leicester, Millbury, Northwood, Shrewsbury, and Upton. So what that comes down to is $62,500, which, and I'll also say that in there is not less than $30,000 shall be expended for economic development in the town of Upton. But I caution everyone with, this is a bond bill. So I make sure that Derek's aware of the money that we're able to secure. You won't see the Upton Town Crier running a press release on it because I don't put out press releases on bond bills. Bonded money is great, but that's only the first step, is getting it included. Now you need to actually get it bonded out, and there's many, many millions of dollars inside of this bill and the next bill I'm going to talk about, and they just think, you know, the administration can't bond everything. But getting it included is the first step. We did a transportation bond bill as well, and inside of that, there was not less than $1.2 million shall be expended for the removal and relocation of a water main on Grove Street in the town of Upton, and the removal, realignment, and reconstruction of the Grove Street Bridge in the town of Upton. So again, we got it included. Now I'm going to go and fight like heck to try to actually get that bonded out. But we wouldn't be able to even have the chance if it wasn't in there. So those emails were sent to Derek and my other town managers somewhere in the neighborhood of 3 o'clock in the morning on January 6th into January 7th, because that was our last official day of business. In a 2-year legislative term, typically the last day for roll calls is in July, the last day in July. And from that, we always are there until midnight, 1 in the morning or so, because we sometimes act like high school students where we procrastinate and we wait on anything that is somewhat big. And that's the same case right now. And we were all the way up until that Wednesday when I was sworn in. So as soon as you gavel out that last day, any bill effectively dies and has to be refiled. So that's why there was such a push to stay open, get them through the conference committees, get a vote on record, and get it to the governor's desk. So that night, and I don't know if anyone saw my post, but that day I was on the phone from 11 in the morning to 4:45 at night, and then I got back on the phone because we had a little break for dinner. I got back on the phone from 5:30 at night to 4:34 the next morning. So that was a long day. Thank God for unlimited minutes and being able to charge my phone. But those were a couple of the really, really big highlights that we got done at the end of session. Now, very, very recently, there was the big stimulus bill passed federally. So Massachusetts is projected to get about $9 billion from the federal stimulus bill. That's going to go an unbelievably long way in terms of helping shore up, any of the revenue shortfalls that we might be seeing. Now, January 27th, Governor Charlie Baker is supposed to put out his version of the budget. Then, now that we actually have a process and a procedure for voting, the House will do our version of the budget in April, assuming everything stays kind of the way it is, and the Senate will do their version in May. We'll go back and forth. We'll get a conference committee budget to the governor. In that, and very recently, the House Ways and Means Committee, which I'm fortunate enough to serve on, the Senate Ways and Means Committee, and the Secretary of A&F came with a consensus revenue estimate of 3.5% growth for FY22. So what that says to me is it's potentially not as severe as we once thought in terms of the revenue picture, but it's very important to remember that that's over the updated projections, which are still $1 billion less than the pre-pandemic numbers that we were basing the original budget on. So when the talk was out there about $4 to $6 billion in the hole, these numbers, if they hold true, are a heck of a lot better than what I think many of us were anticipating. We also did have to dip into the rainy day fund to the tune of about $1.5 billion when we balanced the last budget, but this administration's done a great job of getting that rainy day fund built up, the stabilization account, so it wasn't a really big detriment to us. Now, unrestricted general government aid typically does go up by the rate of the tax growth. So if that 3.5% number holds true, you may see that in UGA numbers coming out from the administration. So just keep that in mind. Really interesting point, and it kind of just goes off a little bit from everything I'm talking about. But Massachusetts home sales hit their 16-year high in 2020. So that's also a sign that I think that maybe we're weathering the storm better than many or better than most. In terms of what we've been doing for kind of throughout the whole pandemic, I've been trying to update my social media platforms as well as maintaining constant contact with town officials for the SBA loans to get it out to all the businesses, PPP, grant programs. I set up a Order Local Food Restaurant Challenge. I tried to drive people to come out and shop local. This Saturday when I was at Nipmuc, I saw people with the Upton Strong masks. I was able to purchase and give out many masks. I think it was about 1,500 masks in total to my 3 towns. And I just want to say now, as I'm wrapping up, and I kind of hit you with a whole bunch of stuff, but if you have any questions about all that, certainly happy to continue talking now or connect offline. But when we gavelled out that Tuesday night into the Wednesday morning, I was sworn in as a member of the 192nd General Court. It's an unbelievable pleasure and an honor to work with all of you in representing Upton. I'm really excited for what we're able to do moving forward. And just so you know my commitment, we just shored up over 1,500 votes consecutively. I've never missed a vote. So while my parents, my wife might not agree with me 100% of the time, maybe some of the people on this webinar might not agree with me 100% of the time, you know that I'm committed to at least being there and making sure that we're trying to get the job done. So it's a real honor to be able to work with all of you. I've spoken way too long, taken up way too much of your time, but I wanted to hit on a whole bunch of information for you. So happy to continue the conversation.
Thank you very much, Rep. Moradian. We really appreciate it. It's always great to have you and get all these updates. Appreciate you including so many pieces of what we had inquired about. So this is awesome. I wasn't expecting you to talk about all of them, and I'm very, in the best of ways, I'm very grateful that you took the time and effort to make sure that you had all those updates and had all that information. I know that was work. So thank you to you and your staff that I'm sure helped with that. So wonderful. we're obviously thrilled with the potential for the bond bills. I think that, the rerouting of Grove Street and the water and sewer infrastructure, those are huge investments that are almost prohibitive for a town like Upton to make. And it seems like the timing may be very good between, being in the queue, having this stuff in the bond bill, having this additional funding coming down and support coming down from the federal government and the state government to augment a lot of what's going on in the economy and some of the spending and stimulus packages. That may be a good coming together of the timing and activities to get some of those funded. So that the potential for that is just awesome. And it's a lot of hard work that you and Senator Moore do to make sure that those things get in there. And Derek, obviously, that you're doing to work with our state officials to get these things included, to have the conversations, to, meet out in the center of town with all the right officials and bringing those people out for us, David. That's all huge. And that's the most we can ask for from you guys. And we really, really appreciate everything you do for us. So thank you. With that, I don't have other specific questions, but Maureen and Steve, go ahead, David.
Well, Dave, I'd like to say it sounds like you've certainly been very busy, and personally like to thank you for all you've done for Upton.
No problem. It's my pleasure. It really is.
I'm not sure
And
what
I'll try to help Hopkinton too.
but I would say thank you for what you do for Upton, David. Excellent job as always. Just one quick question. Over the last, probably 3 or 4 months, it comes up at various meetings. We had a developer in before us a few months back, and different things come up. Questions arise about the scope of Route 140, what the Mass DOT project has planned, that TIP project, what it looks like. I've always thought or believed that it was the accurate description was from William Street to Brook Street. But then I heard something different maybe 6 or 8 weeks ago. So do you have any definitive, or is there any way we could get kind of a definitive idea what exactly the state's doing? And I understand things get pushed back, so I wouldn't ask you for an exact timeline, but as we try to figure out some infrastructure ideas, what do you think that Mass DOT TIP project's actually going to look like?
Yeah, I can certainly get you kind of what their vision is. I believe in chatting with Derek, and you might be able to confirm this. I think it was about 3 or 4 years out is what they're looking at. And Steve, like you said, there are a million different things on the tip that, we can all argue what takes better precedent over another. But they do end up changing from, A to B to C to D sometimes. But I'll circle around with DOT because I wouldn't want to say something in terms of the roads or anything like that. What my understanding is, and have it be different than what they're actually going to be looking at.
Yeah, and I know their plans can change and evolve. And it sounds like, Derek, I think you had mentioned that they've got is it the 25% plan or the 20% plan done for that? So do you have any information that could help us?
Nothing that I haven't already reported. And as I had mentioned on previous occasions, both Chief DeFranco, Chief Bradley, Dennis, and myself held a virtual meeting with Mass DOT. It was sometime in the fall where they presented their 25% design. They had developed 2 different options for the intersection of Grove and Main. Their first choice being a very small roundabout. And so they wanted some feedback from town officials in hopes of presenting this design, 25% design, at some type of public hearing sometime in the spring. And so that's the last that we have engaged with them on this project. And I haven't heard that it's changed. Last we met, it was William Street to Brook Street, but it sounds like Selectman Mattea may have heard something otherwise. But I haven't heard of any changes on that roadway at this point.
Okay, great. Thank you. Just wanted to make sure we pulled out what we knew. So, Steve, it sounds like we can follow up with some of that offline, and Rep. Moradian, thank you for that. Any other questions that we have that we want to ask about? Go ahead, Derek.
I just wanted to thank Representative Moradian because he did present a lot of information today, and he talked a lot about $15,000 he was able to secure for the town. I've been with the town for 4 years now, and every year he's been able to secure upwards of $50,000 one year in public safety improvement. So, we folks need to understand that these earmarks, although sometimes they're large, sometimes they're small, help offset what otherwise would be articles at town meeting. So we put these dollars to great use that both Rep. Moradian and Senator Moore are able to secure for the town. And I'm not going to revisit everything that the chairman had mentioned about the bond bill, but we're constantly engaged with the state rep and state senator on bond bill issues in hopes that someday we can actually get this money approved for procurement at some purpose. But what I do want to say is that this is kind of an inside joke between the rep and myself. He has this funny thing to call me usually around 10:30 at night, not realizing that I'm usually sleeping by 9:45. So maybe next year he'll start to remember that I'm always sleeping by 10 at the latest, even though he still calls me at 10:30. So we're always playing phone tag usually late at night, early in the morning, because he's obviously working late at night and I'm trying to get my sleep for the following day. So I appreciate everything that he's done for the town. He's certainly made my job easier. We had the opportunity to meet Trish and Diane and the Board of Health on Saturday, which was great to see the work that they did and are doing, and will continue to do through the spring. And then we had the chance to go over to the local brewery who invited us, the owners, to give the representative a tour of the breweries to show him and I what their plans are and what they're currently operating. So it was a great day on Saturday just to kind of drive around Upton and see all the great things that happened. So again, I appreciate all the support he's done for us.
Great. Thank you very much.
Well, I really appreciate the kind words. Rushford & Sons is going to be a jewel for Upton, and their plan's really exciting. It really, really is. And just to jump on what Derek said real quick, too, typically at like 10 o'clock at night when the phone stops ringing and I can actually start answering the emails and kind of catch my breath a little bit. But listen, I just want to kind of finish this with saying, everyone with the Board of Health and with Trish, I couldn't be more proud of what you did with Netmuck. It was so cool to be there and see it and see how smoothly it was run. And it makes me so proud to be able to serve you all. It really does. So thank you.
Great. Thank you very much. Appreciate it. Good to see you, man.
Good seeing you guys too. Don't be strangers. Obviously, I think you all have my cell phone number. I'm up. So feel free to text whatever you need, call, text. I'm just a phone call away, a quick little ride. But we're going to get through this. And, I commend all of you too. I know you guys are powering through it and trying to do the best you can for Upton. You certainly are. We're very lucky to have you all who are on here as well.
Great. And anything we can do for you, we're always happy to return the favor. So thank you.
All right, guys. Good luck the rest of the night. Take care.
Have a good night, David. Thank you.
Bye-bye.
So next up on the agenda is Board of Health COVID update. Mr. Holman or Ms. Parent?
Well, first of all, I'd like to say that Trish is the one Trish and Diane really made it happen. It worked. And because of the general's force of us to have a practice section 2 or 3, I think it was 3 times, we had it dialed in long before we set it up. So we all knew what we were supposed to do. And that's because the general, Trish, did an excellent job making sure that we got stuff done. I was really impressed with how quickly and how easily and how smoothly it ran. I was really impressed. And it just went like clockwork. And I think the towns that we served appreciate how quickly and smoothly it went also. So, and we have it coming up in another 2 weeks, right? 2 weeks from today. We are going to do it again, same days, and it's going to go quickly as always. Now, we don't have yet a plan for what the next step is and how that's going to be handled. But as soon as we do, Trish will give us the information and we'll get it out to everybody. So, Trish, why don't you tell us all about COVID and how we're doing there?
Thanks, Al, and thank all of you for the kind words about the clinic. Obviously, it took a lot of hands to make that happen as smoothly as it did. It looked like it was easy because there were so many people that worked together to get it to go forward. We have been practicing since 2001 when the federal government put into practice public health emergency planning committees, and I have been actively representing Upton for the last however many years, right, Derek? I mean, you know, I don't know how many years it was, but it was a lot. And every year we go over our plans for emergency preparedness. And this really is the product of all of those practices and all of that planning, because really you can't do this fly by night. You have to have a plan to do it, or else it really can't come together. So let me back up just a smidge and tell you that as of today, and as I sat here, I had to look at my phone several times because we have gotten more cases in. But as of this afternoon, we had 266 total cases from last March. Obviously, as you well know, we kind of held our own for a very long time in the low risk category until the fall, when we crescendoed with the rest of the world and became high risk. We've been high risk now for multiple weeks. I don't know what our numbers will look like. We have had a little downtrend in the last few days. I don't have a crystal ball. I don't know if it's going to hold. I have seen it kind of mimic the state numbers for the last few days. They've also gone down. Death rates have gone down. Hospitalizations have gone down. This is all a good thing, but it might be just that everybody's back and staying put. No one's traveling right now. They've all done that. We all got those cases already. So not sure how this is going to pan out. But having said that, I am seeing, like Representative Moradian said, some light at the end of the tunnel. I really am, between the cases stabilizing and the vaccine starting to roll. I think we'll see good turnaround by hopefully the spring. Al, I have a little bit of an update because we're throwing in a couple of extra clinics. So we're trying to get through phase one, and phase one not only included the first responders and hospital nurses and anybody else that works in the hospital or nursing homes. It also includes unrepresented healthcare workers. So your home health aides, your physical therapists, your dentists, your chiropractors, anybody who is seeing patients on a day-to-day basis that is COVID facing. And that means the person who's coming in may not know they have COVID. They may get symptomatic tomorrow, but they're seeing you today. They can answer all of the screening questions perfectly fine. They can say, no, I don't have a fever, and no, I haven't been around anybody, but tomorrow they end up with COVID. So those people are at risk. All of those practitioners are at risk, and they are in the phase one of the state's plan to roll out the vaccine. So we're going to try to get our healthcare workers with no other home per se, or nobody else to give them the vaccine, done in the next, we're going to do a clinic on Saturday, much like we did with the first responders. It's being registered for right now. I put the link out today because we received 100 doses of vaccine today. So I will try to get those into the arms of people by Saturday. And then next week, if the state gives me the 200 more doses that I've asked for, we will try to get those into people's arms as well. So having said that, once we're done doing that, I think we will be kind of coming together with the state's plan for phase two to probably start somewhere at the beginning of February. That is the big group that we're all waiting for, the 75s and overs, the people even younger than 75 with 2 comorbidities. It's the essential personnel group, which is a huge group of people, your grocery store workers and your transportation people and your teachers and other school staff that haven't been able to be picked up. So all of these people are very, very important to us. And then the 65 and overs is in phase 2 too, but they're in a lower level of phase 2. So I think what we hope to do is have as many clinics as we can put together and get volunteers for. And we're going to line them up with whatever group is in the forefront on that particular week. And we are going to register those people and put it in the arms of those people and keep on trucking along for as long as we have participation. The state doesn't expect Upton or any of the small towns in Central Mass to do it all alone. They know we can't. They won't even give us vaccine if we're trying to do it just for Uptonians, which is why we've joined together with as many of the little towns around us as we can. There was no way that I could get together 200 first responders just for Upton. And we needed to have 200 people registered in order to get vaccine. Luckily, Upton has been so supportive of the public health nurse in your town forever. And this is when it comes to fruition. This is when it's a big benefit because we already had the infrastructure in place. We had the pharmaceutical grade refrigerator that we got with a grant. We purchased an upright freezer so that we can hold that Moderna vaccine for 6 months if we have to. We did a lot of steps to get this put in place. We had to sign a Massachusetts COVID vaccine program agreement that said that we will follow all of the proper storage and handling. So I had to take the trainings, and Diane had to take trainings as my backup coordinator. And then we had to learn the system that we use that you saw on Saturday, the electronic system that's being used so that all of the vaccine that was given out both on Tuesday and on Saturday was immediately uploaded into the Massachusetts Immunization Information System. It was merged right in there. So if your doctor, if you're a first responder and your doctor wanted to check to see if you've got a COVID shot, later the day on Saturday, they would have been able to do that by going into the information system. It would have been right there recorded, and there's no muss, no fuss. There's going to be a system to remind people to come back and get that second shot. These kinds of things are very important. Now, when we get to the elderly and trying to help our especially mobility impaired elderly or elderly that will have some trouble getting to the Walgreens of the world or the CVS's of the world or Gillette Stadium or Marlborough Hospital or whoever else is giving it to anybody who comes, we want to target those people and be able to get to them. That's what we feel our responsibility is. And they're going to have a little more difficulty with the electronic system. So we're partnering with each of the senior centers in our small towns to try to see if they can come up with a program where they help those elderly register and get them through the process so they can come in and get that vaccine in the arm. So that's where we're at. We're doing it step by step. We're trying not to put the cart before the horse because that's when you get into trouble. Just take it as it comes, get the volunteers, nice and easy. We didn't rush anybody. Everybody got 15 minutes to give a shot and talk to the person because these are new vaccines and people have a lot of questions. I think all of their questions were answered at the clinics. We had a nice system where the EMTs helped out to do the recovery room in the auditorium so that we could keep them separate from the vaccination area. It just was, really, really nice on both the vaccinators and the participants. So I hope it goes as smoothly this Saturday. I hope it goes as smoothly probably every Saturday until, I turn another year older. And we'll just keep doing it. We'll plug along. We'll keep doing it. As long as the refrigerator and freezer hold out, we'll keep doing it.
Awesome.
Do you have any questions for me? I try to keep everybody up to date. It's really kind of I think I could be on probably 10 conference calls a week if I really wanted to be, but I've kind of toned those down and I read the cliff notes from some of the other people. So we try to get the information.
Trish has been working long hours.
My husband hates COVID more than any of you possibly could.
He gave me an earful last Tuesday on the abuse that Trish is taking. Even when she was sick with COVID, she was on the phone doing her stuff. unbelievable. I mean, we are so blessed to have a town nurse. I mean, one of the good things we did over the long haul was to struggle and to keep a town nurse. That paid off with the flu situation some years back, and now it's even paying back quite nicely, 3 times or 4 times as good. So, you know, I can't give enough kudos to Trish and Diane for the work they've been doing, you know, well past what the job describes. So we're really lucky. And the good news is, as a result of Trish's involvement, is that these clinics, we can have them here. So the people in Upton don't have to travel too far to get the shots. That's really quite nice. I mean, you know, the high school is excellent, works out fine. The parking, the flow, everything is fine. We just have to coordinate it with the high school. The good news is they're on every other day or something. So we could run a clinic every other day at the high school if we can get the volunteers. I can't say enough for the volunteers, the nurses that showed up to give shots. Unbelievable. Now, one of the EMTs, I heard the EMTs talking while I was one of the guys that made sure they waited their 15 minutes. The EMTs were talking, Trish, that they can give shots too.
The paramedics and EMTs that have taken the training can, yes, absolutely. Yeah. We may get to them when we get to the general population. I tried to utilize my nurses first because I knew they wanted to get involved. Yeah. So.
Now, the other thing that Liam talked about is if we increase the number of people that come through the clinic, there's room in that auditorium and in the gymnasium to sit, you know, 10 more nurses or shot givers up. So we could double the amount of doses that we could give or triple them based on the space we have. Now, the only question is you have to sit there in the computer and type in all those names. We'd have to have a couple more people doing that because I saw you were going nuts typing all the names.
Well, it's kind of a situation where you just have to get them registered. It's more of a problem beforehand to do double the amount. Yeah. And you have to show the state that you used every drop of that vaccine, which, by the way, we used 13 extra shots. We gave 13 extra shots because there was overfill in that many vials, and the nurse that was drawing up vaccine is extremely good at it. So she was able to get 13 extra doses. So we gave 213 doses out of 200 doses given to us. So when the state sees that, they're very willing to give you 200 more, but you got to show them that you can use 400 more or, you know, by increasing it by double. So that probably will be something we'll look at doing, but right now we want to get the vaccinators comfortable with the pace that they're going. And the feedback I got from vaccinators was they were so happy they didn't feel rushed with this because some of them are very nervous about, some of them haven't given shots in a long time, and some of them are very nervous about a new shot and wanting to make sure they go over every screening question with people and make sure that they're comfortable with what they're receiving. So I was pleased that they were happy with the pace. And,
so as time goes on, what I'm suggesting is that this is a very fluid situation. So we're kind of feeling our way through the dark. The good news, the very good news is that if we're going to any place that this is going to happen, this is the place to have it because Trish is on top of it, and so you know they can throw a curve at us and we can handle it. So we're really in a very good position, and that's as a result of Trish and Diane on top of it.
And I want to also. Well, we also want to thank the schools because they have bent over backwards. The second clinic, the first of the second clinics for the first responders was going to conflict with a basketball game because, of course, now they're back with sports. And they were able to switch the basketball game so I don't have to switch the date of that clinic. So they're just working so wonderfully with us. They're just superior as far as that goes. And many other towns, boards of health have offered places in their town. But like Al said, I'm trying very hard to keep this vaccine very close to the refrigerator. It's a fragile vaccine. when you thaw it out, you're not supposed to shake it around. I have to bubble wrap it to transport it. So, you know, taking it over the potholes of one of the towns that I need to go to may not be the smartest move. So as long as the smaller towns around us are willing to come towards us, it makes life easier for both Diane and I, who are, you know, putting together and taking apart and putting together and taking apart. So we're doing the best we can. And I think everybody knows that we're enthusiastic about getting these vaccines in people's arms and try to get back to some semblance of normalcy somewhere down the road. So in the meantime, we will keep our eyes and ears out. If there's any changes in public health messaging, you can be sure our Board of Health is going to be right on top of it. And we'll keep you guys updated. So.
Well, this is great. Thank you both so much for all of the feedback, for all of the work. It's clearly a feather in the town's cap to be able to provide this service for surrounding communities, and in particular for the town of Upton, right? The fact that it's local, it's close to home, it's our infrastructure, it's our partnership with the schools, the work that you're doing, the people that you're coordinating, the volunteers. There's so much that goes into this, and again, it's just a testament to the capability and the capacity of the people in the town of Upton, and it's great. So it's a great story for the town. We're lucky to have it. We're lucky to have great people running it. So thank you for all of that. And I know that, you know, things will evolve. It's not always crystal clear what the next step is with these things, but as we go through time, I know that you're in a great position to be able to offer whatever services and support we can for folks in the community. So that's great. One question I did have that I got from someone that is a head of a school asked if there was anything in the phasing around teachers, and I didn't know if that was the case or not, or if they just sort of fall into whatever their personal category is. That's where they would fall. I don't know if teachers fit into any particular category that's been outlined in the phasing.
They're phase 2. I think they're phase 2, like step 2, right behind the 75 and overs and 2 comorbidities. They're right after that.
Gotcha.
Yeah, and their school nurses are in phase 1, of course. They're facing the kids that are symptomatic, and obviously they're nurses, so they should get the vaccine now, which most of them have in Mendon Upton school systems, because most of them helped with the vaccine clinics. We would have given them as volunteers anyway. They get a shot. So we've covered our school system right now, but the general teachers and ancillary staff and transportation and everything, I think, comes phase 2, step 2.
Phase 2, step 2. That's great. And then I know for this initial round with the first responders that it was the 7 towns that you were mentioning when we were there on Saturday. As we go into future phases, do we expect that we'll cast a wider sort of geographic net, sort of just put it up on the website, or will it still be confined to those towns, or how will that be managed, or will it change, or will it stay the way it is?
I think that's going to depend on what exactly the category is, because we were talking amongst the boards of health that were there on Saturday that when we get to that 75 and over group that might not be as savvy with registration and so forth, we are actually thinking of doing smaller clinics and taking it kind of a road show to each senior center of the 7 towns, just, you know, spread it out over a week and kind of do a smaller system, only take a couple of nurses and get it done that way, because obviously we have a smaller space and can't crowd people in. They'll still have to make an appointment, but we might have to physically walk them through the registration while we're there. So it might take, you know, an hour to do, you know, just a couple of people. So we don't know how that's going to roll out, and it will make a difference what population we're doing. But when we get to the final group, the general population, or, you know, we may just say we're going to do 2 clinics a week, and if you sign up with our 200, 250, 300 doses, we'll give them to you, and when they're out, go somewhere else. Because there'll be plenty of places given it by that time. I've already seen today, they talked about the partnership with CVS and Walgreens is already going to begin, even in this first phase. So we're already moving along, and I know that a lot of my seniors go and get their vaccines, you know, their shingles vaccines or their pneumococcal vaccines or something that I don't stock in-house. They go to the Walgreens and CVS. They know how to do that. So if they're comfortable to do that and it's open to them, they should go right there. Don't wait for us to do a clinic. But we probably will keep it to the 7 times it started, but we may add Mendon. In fact, we probably will add Mendon because when we get to the school population, for just that reason, Mendon and Upton are a regional school district. So I want to bring them back into the fold. They had already signed up with Auburn. Their first responders had signed up with Auburn, which is why they weren't included in the initial group. But I've already talked to Missy at the Board of Health in Mendon and told her I would send her the link tomorrow for the healthcare workers in Mendon that don't have someplace else to go. So I think we'll include them.
One of the things that selectmen can do, the town can do in general, is to encourage people to get the shot.
Mm-mm.
One of the things that we're beginning to see, not a lot, we've been very lucky. I was talking to the chief, both chiefs, and they've got about 80% of their guys are going to take the shot. So that's good. But my fear is there's going to be, as we get through into the population, into, you know, as we move down to the phase 2 and whatever, people are going to be resistant or hesitant in taking the shot. We need to make sure that people understand that it's okay to do, it's good, and it's the right thing to do. That's one of the things that the selectmen can do in general and the town can do in general, is to encourage people to get the shot. I think that's very important. What do you think, Trish?
Thank you.
Just as we do during flu season, we always say, you know, wash your hands, stay distant, stay home if you're sick. And in this case now we wear masks and social distance and the whole thing, but we also say the other important thing you can do is to get vaccinated. So it's the same messaging, really. One of the best ways to prevent any illness that has an effective vaccine is get out there and get it. And they will, because none of them are approved, remember, for children yet. So all of the adults have to get this vaccine to protect their children. And most of the cases that we're seeing in schools are not happening. They're not circulating in school. They're coming from the household to the kid. Okay.
Yeah. So just want to make sure we cover Steve and Maureen's questions that you might have.
Just a couple of quick questions. Obviously, excellent work. 2 quick questions. I was going to ask, is that the pace? Now, it seems like a lot of people. I know you said that there's plenty of room for that many people to come through, but that seems like a pretty busy day to get 213 vaccinations done. So I guess that was question/comment number 1. And the other question for you, Trish, was, are both vaccines on hand? And you said the Moderna vaccine and is it Pfizer that's the other company? I can't recall what the 2 are.
No, we have no Pfizer. We cannot store Pfizer. We don't have that sub freezing freezer that needs to happen for Pfizer. Pfizer really is kind of dedicated to the hospital setting where they have that type of freezer unit. It would be prohibitively expensive to get one of those, I can tell you that. And I don't know that I'd want to be the one having to track it, because we have to actually record temperatures on both our refrigerator and our freezer twice a day, every day. So Diane and I, one of us has to run into the office and do our manual read for the freezer and the refrigerator. So the freezer is just a regular freezer, and that is good enough for Moderna. Moderna can tolerate the temperatures of a regular freezer, and the vaccine stays there for 6 months if we need it to. Obviously, that doesn't happen because we're going to turn that vaccine over a lot quicker, and it can stay in the refrigerator for 30 days. So we have that leeway. The only tricky part is once you pierce a vial of Moderna vaccine, you have to give out the whole vial within 6 hours. So that's why people scramble around to get those 2 shots left in a vial, and you don't have any more patients. You scramble. You get somebody to come in and get a vaccine. So.
Yep. Steve, did you have another question?
No, that should do it.
Maureen?
Awesome.
Now, I just want to thank Trish and Diane for the excellent job that they've done. I'll bet you'll be glad when this COVID thing is all over.
I'm threatening to take a month off and shut
You
myself off.
deserve it.
Thank you.
One of the things that
Thank you so much. I appreciate you guys coming out and taking all the time to speak with us. So thank you very much.
one of the things that people don't realize is the work is not in giving the shot as much as it is the storage, the tracking, all the support issues that go along with being able to deliver that needle to an arm. And that's what people don't see. That's really where the rubber meets the road. When you're giving this kind of vaccinations out, the support is the critical issue, because it could take one oops and you have 100 doses that are no good. So it's a critical thing. And because Diane and Trish have done such a good job in managing that storage, and we anticipated this kind of stuff by ordering refrigeration units and by ordering the stuff down in the past, we were prepared. So, it worked out. The town has done a good job.
Thank you. Thank you very much.
Thank you guys for all the support. You guys take care.
Take care. Thank you so much.
Thanks,
Great.
Thanks, Trish.
Hi, Trish.
Bye-bye.
Bye.
Next up, we have the fiscal year 22 budget presentation. Derek, I'll hand that over to you.
Okay. Give me 1 second here. So I just wanted to share a screen real quick. See if I can find it. So let me start off by thanking Kelly, Kenny, and Sandy. The document that you received earlier this evening is the proposed FY22 budget recommendation. And Kenny and I will spend the next 30 minutes or so going through it, providing an overview in a similar fashion to the conversation we had with the Finance Committee back in December, where at that point we were just looking at projections both in revenue and expenses. The reason why I'm showing this is because just to kind of give the folks that are watching this meeting tonight just a little bit of a framework. So based upon the calendar that was socialized last June of 2020, you can see here that today, this evening, was the date that we had planned on releasing the budget. So that's what you're going to hear this evening. But then, I guess more importantly, what you'll notice in these two lines here, this is our annual budget review sessions. On February 2nd, we plan to bring in the police chief, fire chief, and the town accountant to discuss specifically their department budgets. And then we'll do the same on the 16th with DPW, COA, code, and so on. So I just wanted to provide a little context to tonight's discussion. Additionally, what I can say is that you will notice that the budget is balanced. And Kenny will get into some more details as to how we were able to balance this year's budget. In parts, you will notice as you meet with the department heads that most of the operational line items are level funded at 0%. And we have just provided a very small cost of living increase to our employees at 1.5%. So those are two of the, I think, major factors in why we were able to balance this. It's typically, if we were to provide all of the typical wage increases, that's usually upwards of $90,000 to $100,000 for all our employees. And then again, this year, what you won't see will be increases in training, increases in other initiatives that departments feel are appropriate and necessary for their annual work. So again, we try to keep this as lean as possible, just to try to get through a little bit of uncertainty. As Rep. Moradian had pointed out, we're not exactly certain what the FY22 budget will be for state aid, and our local receipts look okay, but again, we're trying to be conservative when we look at those revenues as well. So with that being said, I'll turn the data presentation over to Ken Costa as our finance director.
Great.
Can everybody hear me?
Yeah, loud and clear.
Yep.
Derek, if you could, could you bring up the presentation
Yeah, I'll do that for you right
on
now.
the screen?
And one other
Thank
piece
you.
I didn't mention while I pull that up. Typically, you're accustomed to seeing the department line item breakdowns, that piece of the budget. That'll be ready by the end of this week. So what you see this evening are all the front end documents. So my transmitter letter and a lot of the data that Kenny pulled together. So the actual department budgets you will have to review by the end of this week.
As Derek mentioned, the budget is balanced, and the budget is very lean, and we feel that this budget will work well for the town. And it was a lot of work by all the department heads. Thank you, Derek. So I was thinking we can start on page 6. Thank you. So on page 6, this is essentially it's a welcome document, citizens guide to the budget. Welcomes the readers, discusses the budget process as far as open town meeting, and we're now at the process where the town manager recommends the budget. And then the next section is the community profile, talks about the town. Next page. And this gives an overview of the town, and also there's the tax rate. So the 2021 tax. I'm sorry. Sorry, did I have the right one? Okay. Yeah, the 2021 tax rate was $16.20, and the 20 tax rate was $17.22. Okay. The next page is the 22 overview of this is the revenue budget. So the total revenue budget is $25.3 million. That's the general fund revenue. And the largest, piece of the pie is the property tax, which is 89%. State aid is 3%, and local receipts is 8%. And just comparing it to last year, the 21 budget, the only difference was the state aid. We were with the uncertainty of the state aid, as Derek mentioned earlier, and Representative Moradian mentioned earlier. We wanted to be conservative, and not a lot has changed since the last time we presented the revenue budget back in December. So we wanted to be conservative. So last year, the property tax portion was 88%. Now it's gone up, 1% to 89%, and the state aid decreased from 4% to 3%. And if you remember, after last year's the town meeting, when we walked away, that was the big uncertainty, was the state budget. We weren't sure if there was going to be any cuts, and we had budgeted the same amount as in fiscal year 20, so no increase, and that served the town well, because that's exactly what we budgeted, and there was no change. But we actually were projecting the unrestricted general government aid a 10% decrease. That's the largest local aid account. So we're, as the representative mentioned earlier, we could be seeing 0% or maybe an increase of 3%, or we're projecting it could even be a 10% there's just a lot of uncertainty, and we don't know if this is going to be 1 year, fiscal year 22, we're going to, and then fiscal year 23, we'll be back to pre-COVID levels. We just don't know. This could be just a 1 year, or this could be a 2 year. So we just rather be on the conservative side, and we've been doing that, and that's been serving us very well. Next page, Derek. So here is the state aid, which often is referred to the cherry sheet. So this is that 3% amount that we were talking about. This is the pie. So the biggest amount, as I mentioned earlier, was the ULGA, which is 66% of that amount. So in fiscal year 21, it was 565,000, 358. We're looking at, potential 10% cut. That's 56,000, to the town. So we're looking at 508,000. And then there's smaller, pieces. There's state-owned land, which is 24%, which is 202,000 in 21. We're looking at 182 in 22. And then there's smaller amounts. I'll just cover state aid, which is 39,000, just shy of 40,000. We just feel that we believe 40,000. That's something we don't, there's a lot of support for, for education. So we're hoping that it will at least hold to the 21 level, or perhaps there could be a small increase into 22, but we just don't know at this point. And over the next few months, once the governor's budget comes out, and then as the representative mentioned, it will go to the House and Ways, and then at that point, then we'll have a better picture of how the state revenues look for 22. But I just wanted to show you that the total amount of state aid in 22, we're looking at 766,000, and that's a reduction of 78,922, and the percentage decrease is 9.34% from 21. Next page, Tarek. So we just want to show you on the education, the chapter of office, commonly known as Chapter 70. So just gives you a nice 10-year window picture. In fiscal year 12, it was slightly over 10,000. And then in fiscal year 22, we're looking at just under 40,000. So as you can see, there's been a steady increase in education aid. And we hope this, trend continues. But at this point now, with everything that's going on, we're hoping that it will just hold to fiscal year 21 levels. Next page, Tarek. Now this is state aid, local aid, the UGA. So as you can see in fiscal year 12, it was just over 400,000, and there's been a steady increase all the way until actually last year. And we're looking at potentially a decrease in 22. So this is a nice, graph showing the steady increase, which is great. We're hoping that, the 10% will be worst case scenario. We're hoping that they will hold, but just to be conservative, we're looking at a decrease of 10%. Other revenue types, veterans benefits, those are often known as the Chapter 115 benefits for veterans. We're hoping that will hold to the 21 level. We're budgeting 16,000. So this is a reimbursement of the state of the veterans benefits that we pay in a fiscal year in the past 12 months. There's a reimbursement of 75% to the town. So we receive that in the next year. So what the town pays in veterans benefits in fiscal year 21, the town will receive that in reimbursement in 22. Public libraries is often usually known as state aid for libraries. There's a small amount that we receive for that. That's just under $10,000. Veterans, elderly and disabled, the tax exemption, we're looking at about $19,200 that the town will receive. So that covers all of the state aid, and as I mentioned, is 3%. Does anybody have any questions related to state aid? Okay. All right, so the next portion I'm going to get into is property taxes. Like I said, that's the biggest portion of the budget. That's 89% of the budget. And a lot of these numbers, there's very little changes from the last time we discussed. We're looking at as far as new growth, we're looking at 250,000 for new growth. That's what we're estimating. The 2.5 increase is 532,880. And debt exclusions, we're looking at 524,199. There was a small decrease in that. We received some numbers from the school. The next slide, or the next page, you'll see the detail of debt exclusions. So the total and maximum allowable levy is 22.6 million that the town will bring in, and this is real estate and personal property. So a lot of this is formula driven. We talked about this, in December. So as you can see, this is the formula. It takes a look at last year as far as like the limit, and that's like your starting balance, and then it's a calculation. We're looking at, as far as reserve for tax abatements, we're looking to set aside $170,000. And I also, down at the bottom, I just wanted to note that in the fiscal year 21 recap, the excess or unused levy capacity, it was only $2,000. So that was the difference between the tax levy and the maximum allowable levy. So it was very, very small. Next page, Derek. So debt exclusion. So as everybody knows, Prop 2.5, the town is also able to raise monies above 2.5, commonly known as an override. So there's a permanent override, and there's also the debt exclusion, which is a temporary override. And we do have debt exclusions of 524,199. As you can see there, is detailed out. There's the first three that's related to the schools, to the Blackstone, Valley Tech, and then Mendon-Upton Regional School District, and then the water projects and equipment from 2012. So these here, once the debt is paid off on these items, it goes away. We've had a lot of significant debt come off the tax rate over the last few fiscal years. Roughly about $500,000 has come off. So this is what is remaining. And down below, this was taken from the Prop 2.5 primer. There's a 20-page document that goes over how the maximum allowable, the levy ceiling is calculated, and there's the levy limit base, which is the prior year, and then there's the 2.5 automatic increase, new growth, override, and debt exclusion, or capital outlay amount, and there's the levy ceiling. So the previous page, those are all the numbers. This is more the perception of how we get to the total. So if you're not a numbers person, this is the graph, or this is the diagram that you want to look at, just to see conceptually how it's calculated. And previous one, that's if you're a numbers person, that there shows how it's actually, the actual calculation. Next page, Derek. Now we're getting into local receipts, which is 8% of the revenue budget, which is the same as the previous year. The largest local receipt that we have is motor vehicle excise. We're looking at 1.1 million. That's 45,000 above last year's budget. It's about a 4% increase. We're looking at a slight decrease of 30,000 for penalties and interest on taxes and excise. We noticed a decrease in revenue in fiscal year 20, so we just wanted to be conservative into 22. Partly that was because of the relief that was provided last fiscal year when the pandemic occurred. So we just wanted to, we saw a decrease, so we wanted to be conservative. There's a small amount of payment in lieu of taxes. That's a small payment that we receive from the federal government, Department of Interior. Let's see. Fees, there's a slight increase of $7,400. Other department revenue, there's an increase of $19,000, so $541,000, and that's due in part. There's a new intermunicipal agreement with the town planner position with the town of Boylston, and that's part of the increase. So the entire budget is, or the entire amount of the salary is on the town's. You'll see that in the Board of Selectmen's budget, but then this is the offset of that increase. We set aside $35,000. We set aside to offset the increase to that budget. License and permits, we're looking at a $5,000 increase from 160 to 165. This is your building permits, plumbing permits, electrical permits. That's what makes up that number. Next one is court fines. Those are some state revenues, and then investment income. We're looking at those two lines to be flat. So as far as total increase, we're looking at $46,978, and we're looking at a 2.3% increase from the fiscal year 21 budget. Over the years, we've been very conservative with local receipts, and that has served the town well. So when, this pandemic and when, there's downturns in the market, we're able to weather the storm. So we, by the, budgeting conservatively, this has definitely paid dividends to the town over the years. Because I'm seeing a lot of other communities, they're concerned because they do have some local receipts that is dependent on the economy, such as meals and hotel, tax, and that's something that the town we're not seeing decreases. That's something that we don't collect. So that's something that the town is something that is helping us right now. Next page, Derek. And then I'm just going to go through each revenue category. So the next one is first one, or motor vehicle excise. As you can see, from fiscal year 12 to 22, it's just under $1 million, and there's been a steady, increase, up to $1.1 million to fiscal year 22. And this is what you want to see. You don't want to see a lot of, large increases and large decreases in the revenue categories. You can see the revenues are, they've been pretty flat, over the last 10 years, which is a good thing. Penalties and interest, you mentioned we're looking at 85,000 that we're budgeting. License and permits, 165,000. You can see building permits, electrical permits, plumbing permits, liquor license, and other town licenses. So we're looking at 165,000 for that. Next page. And as I mentioned, court fines, we're looking at 31,000. 0% increase, same thing with investment income. 0% increase, we're looking at 10,000. As everybody knows, the rates are low, so we're not looking at a huge increase in investment income. So we're looking to stay conservative at $10,000. Payment in lieu of taxes, same thing, $200. Fees, we're looking at planning board fees, assessor fees, treasurers, fees for services that are being provided. We're looking at $118,550 in fiscal year 22. Other department revenue, that $541,000 total. We're looking at $215,000 for ambulance service charges. We did see a decrease in runs. That's something I've talked to the chief. He's seen a decrease in runs, so we don't know in the next year if that trend will continue. So we just want to be conservative. Trash bag fees, there's an increase. I believe there's about $30,000 an increase to $245,000. And as I mentioned earlier, there's an intermunicipal agreement with the conservation agent and the planner, and that's a total of $58,000. There's also nursing services as well with the town of Blackstone. That's $10,000 that comes back to the town. And then there's also some other smaller revenue types, passports and cemetery burial revenues of $13,000 for a total of $541,000. And again, this is based off trends that we're looking at from fiscal year 21 and 20. The last other revenue funding source would be free cash and stabilization. The great news for fiscal year 22, we're not projecting to use any free cash to balance the budget. And as everybody knows, free cash is one-time revenues. So as everybody knows, we did transfer $259,000 last year from the general stabilization to the general fund to fund for the schools. So that's something that in fiscal year 22 we had to address, and then we had to try to fill that hole right from the beginning. So let's see. I believe that's everything for revenues. Does anybody have any questions on revenues?
Kenny, if we could just pause there for a second, because I think that's really important that, even though we've been able to balance this year's budget, we started this fiscal year already in deficit of approximately $250,000 from the stabilization transfer of last year. So again, I think a lot of great work by you and Deb and others to be able to get this budget to balance, even though we started with such a large deficit. So thanks again.
Yes, thank you.
And Kenny, just a quick question, talking about the revenue side. We're going to show that planner, you said under the Board of Selectmen wage item and budget presentation. We're going to show the offset. Let me just go backwards under local receipts.
Correct, under the other department revenue.
Other department revenue, that's going to come in there. So we're going to, again, that may cause some confusion. People are going to see the full value of that employee, and I think they're going to be upset. So yep. How are we going to be showing that, or how are we going to be explaining that?
So you'll see later in the presentation, you'll see the overall summary. So you'll see an increase to other department revenue, and then you'll see an increase also to general government expenditures. So that's the offset. So the explanation is you'll see an increase in revenue, and then you'll also see an increase in expenditures, and they'll offset each other.
Okay.
So on page 17, this is the overall view of the budget. So as mentioned, we have 25.3 in revenue. We have 25.3 in expenditures. And the largest expenditures we have in the budget is education at 57%. And actually, that's a 1% increase from the prior year. I'm looking at last year's the pie chart, and last year was 56, so this year's 57. And town services last year was 32, and this year 31%. So as you can see, we're doing more with less. So I just wanted to just bring that to everybody's attention. Our fixed costs, they're the same, 12% as the prior year. So fixed costs would be debt service, pensions, health benefits, Medicare, unemployment, state and county charges. So as I mentioned, the state gives us, and we also give it back to the state. So those are the charges. Building and liability insurance and snow removal is what is 12%. So those are some of the the fixed costs to the town.
But again, Kenny, just to hone in on that, when we think of the services provided through fire, police, DPW, EMS, all of town hall, that is just that very small 31% of the entire budget. So, to your point, we're doing a lot of work with with less than 1/3 of the entire budget. So it's a point well taken.
Yep. And another thing too that I know Derek mentioned earlier, and then Representative Moradian mentioned earlier, we're just looking at the budget with all the revolving funds and all the grants. So every dollar counts. Like it's it's amazing, as we're putting the budget together, how the state grants that we receive, the revolving funds, and all of those revenue sources, it really helps build the budget, especially during difficult times. So it's not just when we're building this budget, there's just not just one answer. It's a little bit of everything. It's grants, it's revolving funds, it's looking at local receipts. So there's not just one thing that solves the entire budget, which is a great thing, because it just every dollar, everything, helps out. And the first one that comes to mind is the police budget. It's amazing how 0.5% of the police budget, there was an increase in salaries, and a lot of that was offset by grants, which is a great thing. And that's something that, as an example, the police chief, he does a great job bringing in grants to help offset the costs on the general fund. So kudos to him, as putting this budget together. That's great work by him and his department. Bringing those types of services and bringing those grants into the town. So on the next slide,
quick observation, and as you look back at this and you look at cherry sheet money, for instance, you realize what a small percentage of cherry sheet money is in regard to our total operational budget. When you then look at, say, for instance, what you were just talking about with police, I think it's now up to our 911 grant is up to $325,000 annually, I think, or thereabouts. So
correct.
It's grown significantly over the years where cherry sheet money has not.
Correct.
So, it's interesting how the numbers come together.
Yep. And seeking those opportunities and when they're out there and being able to secure them.
And that's the point we made at the June annual town meeting, when there were some town meeting members who wanted us to hold on the budget and go to a 112 budget until the state came out with their final budget. And we had conversations and we said, well, the state aid is such a small percentage of our overall budget. Even if the $560,000 was a 10% reduction, that's $56,000 that, we'd be able to move some revenue numbers around in order to fill that gap. So to your point, Steve, the state aid is such a small percentage of our revenues. We don't rely on it nearly as much as a lot of other communities do. So therefore, we can continue to, I think, develop very flexible budgets because we're not relying on state aid.
Yep. And also, as I mentioned earlier, the hotel, motel, the meals tax as well. I mean, there are some communities that they really depend on it. They really depend, between $500,000 and $1 million. And that's something that we don't depend on with this budget, which Derek mentioned, lends to the flexibility that we have. On page 18, so this shows the municipal expenses, the 10.9. This is taking out the 14.4 of education expenses. So as you can see, we're 68%, wages and salaries. So we're very dependent on, as you can see, services. 26% is ordinary expenses, and 6% is capital outlay. I can tell you the capital outlay that there's a small amount in the fire department, and there's also, the police department. I believe it's to purchase a new cruiser, and then there's also $562,000 for roads. So out of the, the 25.3 million, 6% is being set aside for capital needs. So capital needs would be anything, greater than 1 year of a useful life. So as you can see, it's such a big budget, and there's a very, small amount that's being earmarked for capital. Next page, Derek. So looking at this by function, the 25.3 million, as I mentioned earlier, education, just shy under 14.4 million. That's 57% of the budget. Public safety is the next largest piece of the pie, which is 13%. And actually that decreased from last year. Last year it was 14%. This year it's 3%. So that's just, it's a remarkable that what they're doing. The next is Public Works, which is 10%. It was 10% last year. And the other big piece is the employee benefits at 9%. And then everything else, as you can see there, between 1% and 2% and 6% for general government. So as you can see, I believe education, public safety, public works, employee benefits, I mean, that's a large portion of the budget. That's about 90% of the budget, right there. And by the way, I mean, I think this chart is amazing. I mean, this is something that I believe we've only done this for the last 2-3 years. So this really shows where the dollars are going. I know, you can see the numbers, but with this pie chart, I mean, this really tells a story. I mean, you can see exactly where the numbers are going and where dollars are being, invested. So I just wanted to point that out. I find this graph very, very informative, very valuable.
One of my favorites.
So this next one here, this is really a top level summary budget. As you can see, it's very important, especially seeing down below, seeing the 2 zeros. That means we have a balanced budget. So revenues and expenditures, that equal. That's very important. I know Derek and I, we've talked about this many times. It's very important to show a balanced budget. And that's something that we're committed to doing going forward. So as you can see, we have property taxes, net of debt exclusion, 4.6%. That's $990,000 of an increase. That's the largest increase in that subset. A lot of these numbers I did discuss back in December. There's not a lot of changes. Just going through and just seeing a lot of them are about the same. I know motor vehicle, we did decrease that. Originally it was 1.2. We did bring it down to 1.13 million, which is a 4.7%, increase there. As we mentioned earlier, that also the 259,000 of the general stabilization, that's the largest decrease on the revenue side. As you mentioned, that's one-time revenues. So, it's something that I'm glad to see that in 22, it's zero, and hopefully we'll keep that zero, because that's something that, one-time revenues, it's something that it's like a snowball effect. It does catch up to you. So I'm glad to see that's zero. So from fiscal year 22 to 21, we're looking at an increase of 651,000 increase in revenues. That's 2.64% in total from the prior year. So not really a large, increase in revenues. And then on expenditures, as you can see, general government, there's an increase of 55,000, and a lot of that has to do with the town planner. That increase there. And as I mentioned earlier, so under department revenue, this is where I'll point that out. Other departmental revenue, that 3.64 is helping to offset that 4%. So the $19,000 increase is helping offset that 55,000 there. So if there's any concerns, how is that going to be presented? That's the offset right there. Public safety, as I mentioned earlier, $40,000 increase. That's only 1.21% of an increase, which is the great work. Actually, both chiefs, are doing with bringing in grants, as you mentioned, 300,000 to even like $1,000 grants that both the chief, the fire chief, and the police chief, that they bring in, from the state. The great work that they're doing. Education, we're looking at $412,000 increase. That's 2.9, percent. Public works, not even 1%, 0.85%. So a lot of the public works budget that I do recall, I noticed a lot of it is 0% increase. So the great work that they're doing. Health and Human Services, a small decrease of $1,500. We're seeing veterans benefits, decreasing from 21 to 22. Small increase there. Culture and Rec, that would be like the library, small increase of $2,300. Debt service is an increase of $10,000, 2.34. State and county charges, small increase, and we don't even know these, the state numbers. We really don't know. So this is really just a guess. A lot of this, the 60,701, those are the fiscal year 21 actual numbers. So we'll have to see. Employee benefits, there's a $109,000 increase, and that's building insurance. That's a lot of that is driving from pension. The pension, there's a slide. The next few pages, you'll see pension. That's an increase of 9.2%. So that's a big driver of that increase of 109,000. So as you can see.
Sorry to cut you off. Just a quick question on and I think, Steve, this was the point you were getting on. I think, Kenny, just making sure I'm tracking with what you guys are saying, right? The
Yep.
general government increase of 55,972 is, I would think, primarily the addition of the planner. And then that number is reduced by the 19,000. So it's really somewhere in the order of a $35,000 change for that position. Is that right?
Correct.
Okay, because I think that's your point, right? Like if you look at the estimated expenses and everything's 1.2, 0.5, and everything's really low, and then you go, oh, general government up by 4%. What the hell's going on? Why is that always, going up? Well, it is what approved last year, but it's really 35. It's not 55, so it's not necessarily a difference. But if that 4 was more in the 2 range, it wouldn't stand out quite so much.
Correct. There's an offset on the
That's
revenue
exactly
side.
what I'm trying to get at is if we know where we can identify it, in the budget and speak to it, we can address it, before it's something that gets held and questioned. It's nice to see that offset. I'm not sure exactly how that math lines up. But again, the important thing is just the offset part of it. So very good.
Yes, there's an offset.
Thanks for pointing that out, though, Steve. I definitely wouldn't have picked up on that. So thanks.
Does anybody have any other questions on this page? Okay.
I guess just a quickie, Kenny, we did talk about it once before at the last meeting, which was the overlay line item. That's going from 150. I couldn't remember if it was going to 160 or 170, but it's going to 170.
Correct. It's going to 170. We're increasing it by $20,000. Just the increases that we saw in fiscal year 20, and then I did notice there was an increase in personal property. So, and I'm just concerned that, there may be, potentially in the future, I just want to be prepared if there's any large abatements with some of the utility companies. So I just like to have that, set aside. I'd rather be proactive than reactive later. So I just rather just, be certain and we'll see, over the next, couple of years, we may, look at that. But I think right now I'd like to go to 170 just to be conservative, just in case there's a spike in increase in abatements in personal property. That's where a lot of that's being driven from.
And last year, I take it we expended the entire 150,000.
So the 150, we didn't. So I wouldn't say we expended all of it. A lot of it we have to set aside because of our receivables, because of our exposure. So in our recap that we just prepared back in November, actually we went to 170 in 21. That was the original proposed amount, but we did go up to 170, and that covered all of our receivables. So it's not just what we paid out; it's also what we have outstanding, what we have out for receivables. We want to make sure we have all that covered, and that's something that DOR looks at, and that's something that they approved. There was no questions related to that. So they were very happy to see that we set aside 170 and we're covering all our receivables, all of our exposure.
Okay.
So on the next page, pension. So in pension, we're looking at 761,042. The other thing I also wanted to let you know, because we're making this payment on 7/1, the payment, because there's actually 3 ways that you can pay for the pension. You can pay for all of it all up front on 7/1. You can pay on a monthly basis, or you can have a designated date. I remember when I first came to the town, we were making that payment sometime in September. And I recall if we pushed the payment back to September 1st, there was savings. And actually this year, by making the payment on July 1st, we're going to be saving $14,000. So this is something that I've been advocating, since I first came to the town. There's a savings to make that payment on 7/1. So we're saving $14,000 by making that payment on 7/1. So so the liability would have been $775,000, and the liability by making that payment on 7/1 is $761. So I just wanted to let everybody know that, here's another example where we're trying to save money. Here's an opportunity to do it. And for me, I thought, years ago, this was a no-brainer, to take advantage of, the savings. So as you can see in fiscal year 12, it was 400,000, the pension appropriation. And now in fiscal year 22, it's 761,000. And remember, this is general fund, water enterprise, and wastewater, enterprise. So each fund has their own portion of the liability. So this is total amount of the of the liability. So as you can see, there's been a significant increase from 12 to 22. Okay, next section, debt service. So I just went back to fiscal year 19 and all the way to 34. So in fiscal year 22, we're looking at 731,947. So I just wanted to show you, to even go back to 19, we're a little bit over 1.2. That was because of the debt exclusions that we've paid off, like Stephens, and there was also the fire station, as well. And as you can see, there's a significant drop off, into fiscal year 21 and 22, and our last year is in fiscal year 34. And all these numbers here, this is all with the realized savings of the refunding that we did back in the fall of 5.5 million. So as everybody recalls, we're saving 548,000. So this is the annual debt service for all funds. This also includes community preservation as well. So this is everything in the general fund, community preservation, water, and wastewater. So these are all the funds. And like I said, in fiscal year 34 will be the last year, and this includes all the savings as well. So this is, the town is doing very, very well with debt service and just keeping these, low. And the next page shows just the general fund by itself. So as you can see, in fiscal year 19, we're just shy of 700,000, and in fiscal year 22, we're just under 200,000, and in 34, we'll be under 50,000. So as you can see, there's going to be a significant drop off, in debt service. So perhaps in the future there could be some, opportunities. The town is looking to make some investments in the town that, as you can see here, there's a lot of flexibility, potentially in the future. And I believe that's it.
Great.
And I want to thank Derek. I want to thank Kelly. I want to thank all the department heads. I want to thank Dennis, the chiefs, everybody. This was a team effort, and happy to see how this came out. As I mentioned, very happy that it's balanced. It's lean and mean, and I think this will serve the town well. So I just want to thank everybody.
Great, thank you for that. Thank you for the presentation. Thank you for all the work and leadership, Kenny. I know that this there's a lot that goes into this across all of the departments. So thanks for all of that. This is a great summary presentation. We're glad to have it, and the fact that you're coming in, you know, with a balanced budget reflects a lot of work and you know, some hard decisions made by department heads and getting the support of the people in the departments and people in town hall. And, you know, there's lots of folks involved that are belt tightening in these tough times. So, so it's appreciated and recognized. So any questions, Maureen or Steve at this point?
No, it's just a great presentation. I think you guys have done an awesome job, everyone across the board. First time I think we've had a balanced budget this early, correct?
I
believe we had a balanced. I think we had a balanced budget last year.
Was it?
Yeah.
Yeah, we
that
made
many
a
years.
couple of weeks ahead of schedule. I think you might be correct, Maureen.
I think so.
And there's a lot, you know, there's a lot more to study here. So I think we got this later or early this afternoon. So there's some more reading and studying to do, but very good. It's as Brett said, there's a lot of work that was done here, and it looks good.
And I think that the key thing too for anybody that may end up watching this later is, you know, this is the first and initial presentation. You know, there's still the Finance Committee's public review. We're going to do a more detailed review with each of the department heads. So there are many opportunities for the public to have their questions answered and to give input either through the public comment session at the beginning of the Board of Selectmen meeting or at the Finance Committee meetings, and particularly the Finance Committee meeting where they actually do a review to answer all the public's questions after the warrant closes and after it's put together, the budget's put together. So plenty of opportunity for people to digest it, but this is great. Okay. Anything else? If not, we'll move over to the donation acceptance.
Yeah.
Great. So I think if you guys have that document in front of you, it's got neighbor-to-neighbor donations and some food pantry donations.
Did you want to discuss it at all, or do you want to just kind of mention what the numbers are and then we can motion it?
Yeah.
Okay, I have my laptop open in front of me. So we received, on behalf of the neighbor-to-neighbor program, I'll mention the names: Stephen and Eileen Rackerton for $1,200, Walter and Marcia Priestley, $600. And then on behalf of the food pantry, Upton's Professional Firefighters Union made a donation in the amount of $150, and Stephen and Carlene Chase, $100. And then Council of Aging General Use, this was collected by Unibank, $295. It looks like what the donation was made or will be made on behalf of, looks like in place of the Giving Tree. So I guess I'll say thank you to all those people that were so generous with their dollars in these tough times. Maureen, did you want me to motion it, or would you like to?
No, you can motion it.
All right, very good. I would like to make a motion that we accept the following donations on behalf of the Council of Aging and the Neighbor-to-Neighbor program. The amount of $1,200. Mr. and Mrs. Rackerton, the amount of $600. Mr. and Mrs. Priestley. Donation for the food pantry, Professional Firefighters Union, $150. Stephen and Carlene Chase, $100. And the Council of Aging General Use collected by Unibank, $295. Make the motion, Stephen Mattelli and I.
Second, Maureen Dwinell, aye.
Brett Simus, aye. Unanimous action. Thank you. And then I think the last item on the agenda is the town manager report.
All right. Well, I'd start by saying that the last couple of weeks it's been mostly focused on the budget. As you can tell, there's a lot of work that went into that. As Kenny pointed out, the department heads all did a good job sharpening their pencils to make this budget work this year. So we really appreciate their support and their indulgence in those tough conversations we had to have. Moving on to some things that have happened in the last couple of weeks. So I met with Janice Nowicki today, and it's great to see that the community is still supporting the senior center and the work that they do and the Neighbor to Neighbor program. She did let me know that since the senior center had released their flyer in the town crier, which was back in mid-December, and then there was a follow-up article by the town crier approximately 2 weeks ago, they've had 12 requests for neighbor-to-neighbor support. Now, if you remember the last time Janice was here, I think a question came up of how many touch points or individuals has she assisted, and her response was she's assisted 12 of our residents. So just in the last 30 days, she's already equaled the work, the output of the neighbor-to-neighbor program for the first 9 months or thereabouts. So given that, she does expect to have to come back to the board in a future meeting to ask for additional support given the most recent requests. And you will notice in the letter or transmittal of the budget document you received today, we did continue to publicize the neighbor-to-neighbor program at the very bottom of my letter transmittal. So again, trying to find every different way we can get people assistance as best that we can.
Sorry to interrupt you, but that's phenomenal news. I think that that's something that we all struggle with, is how do we get people to take advantage of this program. So that's great to know that there's that much interest in advertising for that, and hopefully it's one of those things where the more word spreads, the more people become aware of it, the more people sort of destigmatize it or normalize it and say, hey, you know what, this is there to help. It's not a bad thing. It's not an embarrassing thing. So-and-so did it and so-and-so did it. It's powerful and good that that's moving forward. So great job on their part for doing the advertising.
And I kind of feel like the conversation that we had at the last board meeting, there were folks in the community that I hope were kind of those connecting points, right? Those touch points, how we're trying to spread the word, because I think to your point, Second, is that word of mouth is probably the best avenue. It gives some folks a sense of safety. So I would imagine that was a big component of these last 12 families that I asked for support.
Great.
So we'll continue. Again, always open to suggestions how we can get out there, but we'll continue to do the best that we can on that front. So one thing you may have learned about in the newspaper or through the local media, and we haven't talked a lot about it, is the Governor Baker signed the police reform bill. And so Chief Brad and I, we had a conversation today, and they're actively reviewing the police reform bill. Many of the components will be effective come July 1st of this coming year. So giving some time to the police departments to look at the reform bill, change policies and procedures where or if necessary. They don't all apply to all different departments based upon current practices. So as the chief goes through that, we thought it would be a great idea for him to come at a future meeting where we have a lighter agenda, and he can explain to the board the different pieces to this legislation, and not only how it's going to affect our police department, but really how it's going to affect law enforcement as a whole in Massachusetts. So he's committed to that. So we'll just try to, if the board is willing, we'll try to find some time for him to come in and have a conversation.
Yeah, that's awesome. That would be great to understand that.
Yeah, absolutely. I've heard little rumblings from one of my police officer friends about the bill, so it'd be great to get the chief's perspective on that when he has time, and we, as you mentioned, when we have a light agenda, that'd be great.
Right, and as you all know, Chief Bradley, he is not only on the accreditation board, but I believe he is the vice president to the Mass Chiefs Association, and I believe he becomes president in a year from now. So he's actively engaged in statewide conversations, which is great to have him have his ear to the ground, have those conversations at such high level. So we appreciate him doing that on behalf of the town.
Yeah.
And then as far as COVID, again, the Board of Health, many of us had an opportunity to go by there and visit the work that they're doing. And I remember someone asking me, how did we get a clinic or a emergency dispensing site here in Upton? And it's 100% because of Trish. She's the one that advocated. She's the one that thought we could do it here in town, and she's the one that's kind of pulled it all together. So, great work by Trish and Diane and all of the supporters. But our fire department, our police department, both had an opportunity to go there as first responders and with the dispatchers to get vaccinated, and we've had upwards of 80% vaccination rate amongst our first responders. So again, a great turnout and show of support by our first responders here in town. And then the last piece I'll just bring up is the town planner. So the town planner, again, continues to not only learn the town, but trying to find every area of opportunity where he can uncover resources and bring those to the community. So as you know, he's working with the Economic Development Committee. He's going to be with the ZBA tomorrow night and certainly working closely with the planning board. But with a meeting I had with him today as well, he did let me know that he has engaged on the Shared Streets Technical Assistance Program. He's trying to figure out what that will mean for the town of Upton, if that'll bear any fruit. He's also engaged in an affordable housing workshop. As you know, we own an affordable housing trust here in town. We own property, or they own property that they want to turn to affordable housing. So I think the town planner will be able to bring some insight to that group as well. And then last, he has recently met with the president of the Blackstone Valley Chamber of Commerce to start to have beginning discussions, hopefully for late spring, early summer, to hold a business roundtable. And again, doing that in concert with the Economic Development Committee. So again, a lot of work's coming, even though he's only giving us 20 hours a week, still a lot of work that's coming out of his office. And I look forward to some of the accomplishments that we're going to see by having him on board. Pending any questions, I'll turn this back to the chair.
Thank you. Maureen, did you have a question or comment?
No, nothing tonight.
Okay, great. I'm just curious, Derek, do you happen to know the name of the president of the Blackstone Valley Chamber of Commerce? It used Chamber of Commerce. It used to be Jeannie Heber, but
Still is.
Is it still her? Okay,
Yeah.
Just curious. She's been doing that for a while. Okay, cool. Steve,
I think I was wrong. I think her official title is executive director. I think that's her
executive director. Okay, yeah.
Any, what is the discussion on the business roundtable? What are they actually thinking about doing?
I know initially they want to bring them together. There has not been a forum to have all the local businesses come together and talk about some of the issues that they're faced with here in town. That could be taxes, that could be the permitting process, that could be, maybe needing local support. Jeannie Hebert has done this in other communities. I know Northbridge, for example. I'm close friends with the town manager in Northbridge. I know they've done this pre-COVID on a couple different occasions. So she has funding in order to launch an effort like this locally. So I think that's really I think that's going to be the initial starting point, just to bring them together and have conversations.
Yeah.
Okay.
Excellent. The only other thing that I have is I didn't know I was going to be asking about this, but I just heard about it today. I know we've talked a lot about the three-phase power over by the railroad. And Steve, you had asked about three-phase power sort of up 140. Do we know if there is three-phase power up there? And what made me think of it was there's a company that was in a facility and needed to grow, and talked about the fact that they had to move to a new facility because there wasn't three-phase infrastructure where their current facility was. So I was just curious if, along 140, if in addition to water and sewer, that's another constraint that we might have, or if that's something that's already in place.
Well, based upon conversations I've heard in the past, we don't have three-phase power in that direction.
Okay.
But I don't know for certain, but I agree with you. I think it's something that we should pay close attention to, and if it's something we need, then we should consider it.
Go ahead, Steve.
I do have something on this. Yeah, when I had brought that up before, again, we had a situation where, just to refresh everybody's memory, we had a situation where we had one of our tenants that was looking for three-phase power. It was not on our particular section of Route 140. We could have brought it in, but there would have been significant expense to doing so. But there is three-phase power as you get over to, we actually, Route 140 intersects with Hopedale first.
Yeah.
But there is three-phase power, I believe, about a quarter mile up from our shop.
Going toward Hopedale area. So it would come down that way, not come up from the center of town.
That's correct. Yeah, if you want, right, to expand as far, that's my belief, because the machine shop, that's again maybe a quarter mile away from our shop, there is three-phase power there.
Up there.
And I'm almost certain that it comes from the Hopedale line.
Yeah.
Comes in that direction.
Yeah. Okay. I was just curious because I know always in my head is the water and sewer infrastructure, but then I was like, oh, if someone was going to put a manufacturing facility out there in some of our commercial and industrial area, that may be another thing to think about, particularly as we're doing the tip work or what have you. But because that's coming from West Upton up, maybe it's less of an opportunity that we could tie. But I wonder, it's something to think about as we look at grants or we talk to Rep Moradian or there's infrastructure grants or what have you. Just something to keep in the back of our mind that maybe, one step closer to making that desirable space up there.
Yeah,
Okay.
and three-phase, maybe down Maple Avenue, and I think it may be at Blackstone Valley Tech School. So power comes into town from what I've always been told from different areas.
Yeah.
I believe my brother lives in the vicinity of the schools, and
Yeah.
I believe the power comes from Northbridge,
Yeah.
up,
Okay.
to feed the two schools. So I think they have three-phase in that area of town as well. But yeah, as far as Route 140, you're right. That's something you kind of have to look at to try to decide. I think water sewer is more of the detrimental factor versus the three-phase power. But
Yeah.
that's my opinion.
Because you could put that, you said you could put that in, so that's a little easier probably to get in than water and sewer, which is a whole different ballgame. So
Yeah,
okay.
It's a manageable number. It's expensive, but it's a manageable number where water and sewer really is not.
Gotcha. Yeah, if there was a big business that was coming in to grow or put in a facility, they wouldn't mind spending some bucks to get the three-phase power there versus they're not going to spend millions to get water and sewer. Yeah. Okay.
Exactly.
Yeah. Okay. Great. Well, that's all. Thanks for talking through that a little bit. Appreciate it. If there's not anything else, I'll take a motion to adjourn.
I move that we adjourn. Maureen Dwinell, aye.
Second the motion, Stephen Mattelli and I.
Brett Simons, aye. Meeting adjourned. Thank you, guys. We'll talk to you soon.
Have a good night.